Holidays can be a time for overindulging in food and drink, and for people who regularly suffer from heartburn, this overindulging can make conditions worse. Before you reach for the heartburn medication to relieve your symptoms, it's important to find out if there's something more serious going on. Joining us now is Dr. Sachin Wani, Associate Professor of Gastroenterology at the University of Colorado. And Doctor, thanks first of all for being here.
Of course, thank you for having me.
Absolutely, it's so great to have you. So let's talk about how prevalent that chronic heartburn really is in Denver.
Yeah, so heartburn, or the sensation of burning behind your chest bone or your upper abdomen, is exceedingly common. Based on a recent survey, we actually found that nearly 70% of Denverites actually suffer from heartburn at least twice a week, if not more. And if you actually look at this problem nationwide, nearly 20% of all U.S. adults actually suffer from chronic reflux or reflux symptoms on a weekly basis. So these are really astounding statistics.
So why is it important that people have this checked out?
Yeah, I think there's several reasons why you should consider talking to your primary care physician and your gastroenterologist if you have chronic heartburn. And there's several reasons. The first one is these symptoms are annoying, right? I mean, it can affect your day-to-day activities.
Oh, absolutely.
And it can really negatively impact your quality of life. But just as important, if not more important, is the fact that this chronic reflux in a select few individuals can result in a change in the lining of your esophagus and result in a condition called Barrett's esophagus, which is a precancerous condition for esophageal cancer. You should also be seeking medical attention if you have any of these alarm symptoms or red flags, such as unintentional weight loss, if you have anemia, if you have trouble swallowing. So if you have any of these symptoms, you should definitely be talking to your primary care physician and your gastroenterologist.
Makes sense, absolutely. I think there's a lot of people that don't realize there's that link there.
Yeah, I think you're spot on with that assessment, and that's exactly what our research showed, that the majority of individuals actually do not recognize this association between chronic heartburn and esophageal cancer. It's important for our viewers to recognize that that really is the most important risk factor for esophageal cancer. And to be more precise, it's esophageal adenocarcinoma that we're really talking about. This really is one of the most fastest rising cancers in the United States. It's really unfortunate that the vast majority of patients that we see at our center really come in with advanced or late-stage cancers, and that really is a paradigm that we're trying to change with our ongoing efforts. It's not just reflux, though, that puts you at risk for esophageal cancer. It's also individuals who smoke, who have a few excess tires on their abdomen, white males. These are all individuals at risk for esophageal cancer. So our viewers really need to be aware of this.
Those are good tips, absolutely, for people to be thinking about. You also have some great advances that help you sort of identify some of these characteristics before it gets too far into the process, right?
Yeah, absolutely. So this has been work in progress, and the GI community really has come up with significant advances in the way we can actually diagnose patients with Barrett's esophagus and esophageal cancer. To start off with, we use these high-definition endoscopes, and our screens actually look very similar to the high-definition TV screens that we're used to when we do endoscopy. We've also made some advances in the way we can sample the esophagus, which is a muscle tube through which food goes from your mouth down to your stomach. So we take a good look at the lower part of the esophagus. We sample the entire Barrett's esophagus, which is the precancerous condition. But above all this, I think the biggest advancement that we've made, Gina, in the way we manage these patients is our ability to actually treat patients with early cancer. If you're fortunate enough to get diagnosed with early cancer, we can actually take care of this using our endoscopic tools. So we're moving away from this time where we were referring all these patients to our surgical colleagues, and they would undergo this morbid procedure where they have a part of the esophagus and stomach resected and then connected to each other.
So briefly, let's talk about your campaign, PreventHeartburnCancer.org.
Yeah, so this really is an educational initiative with our long-term mission to stamp out this cancer. You can get a lot of this information on the website. We're sending this message to our primary care physicians as well. And we've also provided contact information about our digestive health center and our esophageal and gastric multidisciplinary clinic. And we'd be happy to answer any questions or concerns that you may have.
That is amazing. Thank you so much. Something to think about this holiday season, that nearly 70% of Denver residents have chronic heartburn. That's more than 2 times per week. 65% don't even check to see how serious the condition. To find a gastroenterologist near you, visit PreventHeartburnCancer.org. They paid for today's segment.